Well, hello, everybody. Today, I want to talk to you a little bit about how what you believe shapes what you achieve. And it's not just in goals that you set up for your career or um, for whatever other area of your life you're setting goals, but it can also be applied to your health. Hi, everybody. My name is Alexandra Santamaria. I'm the founder of RX Health and Wellness. And I really want to talk about something that I hear very often from people when I meet them to coach them for diabetes. And that is that they think there is nothing that they can do to improve their health. There's nothing they can do to improve their diabetes. They often will say to me things like, I've tried everything, nothing works. Diabetes runs in my family. This is the way it's going to be. This is just my fate. I hear this all the time, and it is really discouraging because a lot of times I can't change people's mind when they have this mindset that nothing that they can do will change the outcome for them, that is set that they will die from this disease. Uh, it breaks my heart because I hear it more often than you imagine from strong, smart, hardworking people who just feel very defeated, who feel stuck, who believe deep down that no matter what they do, nothing will change. And it's just sad because there's no hope in that. There's just, it's just sad. But I want to challenge that belief if you're one of those people today, because what you believe shapes what you achieve. So we've heard it when it comes to your career, when it comes to other goals, but it can be applied to your health as well. If you believe that your health can get better, then it will if you try hard enough to make it so. And you just might do it. But if you believe that you can't, then you most certainly will not, because you won't even try, because there's no hope in there. So I want to tell you a little bit about two stories that are very similar, but two very different paths. So I had two patients, not the real names, but we'll call one Maria and the other one Angela. Both were in their mid 50s, both diagnosed with type 2 diabetes at least for a year or more. Both had very busy lives and stressful jobs, and they both have families to take care of. They were very scared. They felt overwhelmed and frustrated, as you can imagine, because they felt like, uh, they had so much to do. This was something they were going to put in the back burner because they had to take care of their families first and then go to work. Secondly, and they were just very busy all the time. So honestly, they both had every reason to feel that there was no way that they could do something about it. Like I said, they were both overwhelmed and frustrated. But here's where their stories began to differ and change. Maria told me, I've tried everything. My mother had diabetes. I'm just waiting until I go blind as well. So I'm going to eat whatever I want and enjoy myself. I'm already tired of living this stressful life full of rules and restrictions. She felt that people were just telling her everything that she couldn't do. So she was focusing on the negatives. She was focusing on all the things she couldn't eat and all the things that she wasn't able to do, like partying and drinking and socializing, she thought. While Angela, on the other hand, she cried in my office, looked at me, and said, I don't know how, but I know I don't want to live this way anymore. I don't want my story to end like my other family members. She was afraid too. She had also tried diets before, but instead of giving up, she stayed open to the possibility that there was something that she could do, something that could be done for her diabetes. She stayed a little curious. She decided to try things again, not the same old way, but maybe in a new way. We talked a lot about trying small steps, making small changes that once they stick, they can add up to one large change. And over the next 6 months, Angela didn't do anything extreme. She didn't starve. She didn't work out for hours. She just started to walk 15 minutes after dinner. Dinner was her largest meal of the day. She cut out soda. She learned how food affected her blood sugar. So we had talked about using continuous glucose monitors or CGM, and her insurance would not pay for it. But she decided to buy one out of pocket. She asked her doctor for the prescription, and she bought two sensors for 28 days. And she put one first for 14 days. And that's how she started to use it. And then she would take a week to 2 weeks off and then try the second sensor. So she was learning how food affected her just while she was wearing her CGM. She practiced breathing when stressed instead of reaching out for snacks. She started to realize that when she was very stressed, it led her to overeat. 6 months later, she had lost 12 pounds. Her A1C had dropped all the way down to 5.6, and her doctor took her off one of her medications. Maria, meanwhile, kept spiraling down. Every time we would see her, her blood sugars were higher and higher. Her A1C kept going higher and higher. And all she kept telling me is, see, nothing works, not even all the new medications that we had put her on. And she would say, I knew it. Nothing will ever work for me. She wasn't broken. Her beliefs were broken. And she had no hope of getting better. In her eyes, this was the only possible outcome, and her belief became a reality. So, your mindset is really important when it comes to any type of illness in order to get yourself healthier. We talk a lot about medication and meal plans, but let me tell you, mindset is medicine too. If you work on your mindset along with all the other things that we do, meal planning, exercises, reducing stress, better sleep, if you're walking around believing that you're doomed, it's going to come through believing that you can't get better, it's going to come true. Then guess what? Your body listens and your brain finds proof of whatever it is that you believe. If you believe that you can't lose the weight, you'll sabotage all your efforts to lose the weight. If you believe change is hopeless, you'll stop trying. But if you believe there is even just a small possibility that you can get better, if there is just a small possibility that you can lose the weight, if you believe progress is possible, if you believe you can bring your A1C down, if you believe that you can put diabetes into remission, then you show up differently for yourself. You look for solutions. You give yourself permission to try different things, to try things over again. You become open to the idea that maybe, just maybe, you are more powerful than your diagnosis, that you can take control of your life, you can take control of your health. Might as well eat what I want. I hear that all the time. I'm already, in my 70s, or I'm already in my 50s, or I'm already 80 years old. Now I want to speak to you directly. If you're that kind of person that is telling me I'm too old, so I might as well just eat what I want, or my sugars are too high, so I might as well just enjoy myself, or I'm gonna be sick anyway and get worse, so I might as well just do what I want. Well, if I'm going to die anyway, I might as well eat what I want. Let's pause here. I hear you. I get it. It's tough. But it's this thought that usually comes from pain, from years of dieting and deprivation, being told that you can't eat this, that you can't have that, being judged for your body, and being made to feel like it's all your fault. But let's pause here for a minute and let me ask you this. What if the choice wasn't between eating what you want and suffering? Because if you put it that way, nobody's going to pick suffering, right? What if you didn't have to live in deprivation? Because it doesn't have to be that way. What if you could find joy and flavor and pleasure in the food that also supports your healing? Could it be possible, maybe just a little possible, that there are foods out there that are good for you and taste good? Or you're just willing to only eat those foods that you know you like and you know they're killing you slowly? You see, it's not about punishment. There's no one in healthcare that wants to punish you. There's no coaches who want to punish you, no health coaches, no diabetes coaches. What we want you is to be free from finger pricks, from taking all kinds of medications, from being exhausted, from fearing that you won't see your kids grow up, or see them get married, or hold your grandkids. What we want you to have is belief that maybe, just maybe, things could be different. And if you believe that belief can lead to taking action. So here's the truth. When you believe change is possible, you act like it is. And when you act like there is a possibility, then you start seeing changes. You can start walking after meals. You'll start sleeping better. You'll learn to manage your stress without food. You start choosing meals that are good for you and nourishing instead of spiking your blood sugars. You surround yourself with people who lift you up and encourage you to keep going. And one day something clicks. You check your blood sugar, and for the first time in a long time is under 120. You go to the doctor and they say, hey, this is looking much better. Keep doing what you're doing. You look in the mirror and think, I did that. I'm doing this. That's what's waiting for you on the other side of possibility, on the other side of what if you could take control of your health. What if you could have all the food that you wanted is good for you and nourishing? What if you don't feel deprived? What if you don't feel like you're being punished? What if you could live a life that you want, feeling great without finger sticks, without tons of medications, without feeling overwhelmed and exhausted? So that's what's waiting for you on the other side. But first, you have to believe it is possible. So here's the thing. Here's what I want you to live this video with. If you believe that you can get better, you will. If you believe you can't, then you won't. But either way, you're right. Today, I challenge you to question the beliefs that nothing will work. I invite you to try again, to switch from focusing on all the things that you can have, on all the things that will go wrong, on all the things that you have tried and did not work when you tried. And I invite you to try again. Not because you failed before, but because you're now wiser and you learn from that experience and you will do things differently in a way that will now work for you. You're not starting from scratch, you're starting from experience. This is not your fault, but it is your responsibility. And the power to change is still inside you. So I'll ask you, as much as I want to do it for you and I want to help you and I want to make it easier for you, I can't do any of that until you believe that it is possible, until you believe that you have a brighter future in front of you. If you just start making small changes and focusing on the positive side and leave the negative side aside. Don't focus on what you can have or you can do. Focus on what you can do now. Focus on those foods that you like that are nourishing your body and helping you get healthy. Focus on the exercise and the movement that you can do now that will help you not only bring down the sugars, but maintain your weight and possibly even help you lose weight. This is not your fault, but it is your responsibility, and the power to change is yours. So I'll ask you, what do you want to believe today? And what is one small step that you can take that will align with that belief? Because that first action, that first step is so important. That's the beginning of your comeback story. That's the beginning of your future. Every action you take today to improve your health is a promise to yourself tomorrow that you'll have a better future, that you'll have a future where you're not suffering from complications, that you're not suffering from not feeling well all the time and being stuck at the doctor's office all the time. It's a beginning of a better future, one where you'll be full of energy, vital, and be able to enjoy and do all the things that you like. Thank you. I hope this helps. So, if you suffer from a chronic disease or you suffer from diabetes, your health starts with your mindset. Really believe in the possibility. I've seen it over and over again. It can be done. It is possible. You just need to believe and you just need to take action. Take that first small step. And if you need help, please come and visit us at RX Health and Wellness and see if we can help you. Take care. Bye.